So welcome back to the Hart2Heart podcast. And today my guest is my man, Dr. Patrick Phillips. So Patrick is another physician in Ontario who's been, pretty outspoken about COVID, and I'm really excited to have him on the show here today. So Patrick, welcome to the show, and just tell us a little bit about yourself.
Thanks for having me on, Mike. I'm a family doctor by training. I did my med school at Dalhousie University in New Brunswick, and finished my family residency training at the University of Toronto. And since then, I've basically been practicing locum emergency family medicine and hospitalist practice throughout Ontario, but mostly in the north. And just in the last few months, I've settled down in a town of Hart, Ontario. So it's a town of 1,500, about 6 hours north of Toronto. And so I'm mostly doing emerge there, and dabbling a little bit in hospice and ICU as well.
Awesome. So covering a lot of bases there, but certainly your ER knowledge, can definitely come in hand when doing some COVID stuff, and also the hospitalization or the hospitalist stuff that you do as well. So thanks so much for telling us about that. So today we mostly want to chat about COVID, and like people who watch this show, I've had a lot of precautions against lockdowns, and I've said that we should be ending the lockdowns, and I think that they do a lot more harm than good overall. And Patrick is one of the rare MDs who also thinks that way. So firstly, like, did you start thinking that we shouldn't have lockdowns like right away, like this time last year, or was that something that sort of like gradually came about over the summer or the spring, or when did you kind of first start thinking that, man, we might be doing the wrong thing here?
Yeah, so I was like most physicians in the beginning. Like I was seeing what's happening in Wuhan, in northern Italy, seeing like bodies piling up and everything, like in New York City. So yeah, I was pretty scared, and I was in favor of lockdowns in the beginning, because from what I thought and what the media was portraying, I thought the plague was going to come through, where a significant portion of the population was going to end up dead. So I drank some of that Kool-Aid, right? And I was in favor of shutting down family doctors' offices and all these other things, because it made sense. If 20% of the population is going to die, or that's what it seemed like a huge percentage, why are we doing cancer screening? What is that going to even do? But then things started to change, right? Like that, we started to get more realistic statistics. We started to see more realistic picture of what was happening, especially as COVID started to spread through the States. But I have to admit, I mostly tuned out through the summer, because in Northern Ontario, which is where I work primarily, there was almost no COVID. So even though it had hit Toronto somewhat, it wasn't really up there. So the knowledge was developing so rapidly that I just kind of decided I was going to tune it out. And when COVID started to come around, then I was going to start to pay attention. But I have to say, like, through the fall, I started to notice some things that were pretty disturbing. So even though COVID at that time hadn't really come up there, it's there now. But I started to see a lot of things coming through my emerge that I wouldn't normally see. And one of those things were people like in their 40s, 50s, coming in for relatively benign complaints, but they either hadn't been seen by their family doctor over the last year, or they were too afraid to go in to go seek help for things like belly aches or just back pain and things like that. And when I actually examined them for the first time in over a year, I had a significant number of patients with full-blown metastatic cancer. And it was when I started seeing that, like, back to back, like every week, seeing these patients coming in, I knew something was really wrong, and I needed to kind of reevaluate, like, what are we doing with these lockdowns? So that was probably the main thing that first woke me up. But there's so much more once I started paying attention and seeing all the damage that these lockdowns were doing to people's health. That's what led me to know that I really needed to speak up, because nobody's speaking out against these lockdowns, despite the fact that it's causing massive damage to people's health.
Yeah, and I'm in the same camp as you, Patrick, for for, initially the response, and what I thought about COVID was like, these numbers were coming from, the CDC. So, that, I was only, supposed to believe those numbers type of thing.
Mhm.
It's supposed to be a respected source. And, initially when it came out, it said that, it was like 10 to 40 times more deadly than the flu. And they said that it was, 2 to 3 times more transmittable.
Mhm.
So, I was freaked out, and I thought for sure that, we were going to have to, close down everything, and that we should close down everything because, those numbers, scared the shit out of me, really,
Yeah.
and like if those numbers had been true, then, it probably would have been a good idea to do the lockdown potentially. But, we don't live in that world anymore. It's
Mhm.
not 12 months ago. The numbers are different now, and it appears that, maybe it's a little bit more harmful than the flu for sure, but it's definitely not, 10 to 40 times more and 2 to 3 times more transmittable. So, I'm in the same camp as you there. And I know, Pat, like, a lot about, some of the different treatments for COVID, more than I do. Like, I've been pretty vocal about, vitamin D, because vitamin D, seems to reduce overall hospitalizations and ICUs,
Yeah.
admissions. And there was one study fairly recently, maybe about a month ago, that said that it also decreased the rate of transmission or infection by about 34%. So have you kind of done some research on vitamin D? Is there anything that I'm missing that you can tell us about that?
Yeah, so vitamin D actually is one of the few things that I actually did start to pay attention to in the beginning, because there was a lot of evidence that was piling up that your vitamin D status, if you're vitamin D deficient, your chances of a hospitalization or ICU are significantly higher. And if your vitamin D level was normal, then your chances of ICU admission or death were quite low. Um, and so I saw that from the beginning. And so that was one of those other things too that kind of woke me up, that like, okay, there we have this very simple, safe, and effective means of preventing harm from COVID, from preventing our hospitals from being overwhelmed. So why was this not in the public health recommendations, right? So that was one of those things too that was just kind of ticking in the back of my mind. Like, when I'm seeing we're locking down, we're causing massive harm to people's health, why are we not doing something so simple as vitamin D? That's now, like, especially by the time of fall, there's like tons of research studies that have shown that it's effective. Um, uh, but there was not a peep, right? Not a peep from the public health establishment. Um, and that was something I was pretty shocked by. And I started to recommend that to my patients for sure, is taking vitamin D. Um, and what I would hear from other doctors, right? Like, and even ones who evaluated the evidence, is that, oh, there's not a lot of great RCTs. Um, but what's clear is that your vitamin D status, um, is effective, and there are some RCTs actually out there. But the problem is, that people get a little bit confused is that vitamin D takes probably at least a week to really kick in. It's a hormone in our body, right? That influences the way that our body expresses proteins, uh, and uh, and how our immune system works. And so that takes actually, probably several days for that to kick in. So if you're going to take it just when you catch COVID, it's probably not going to be that effective. But for a preventative measure, um, we should be taking it anyway. It's well known
Exactly.
in Canada, that most Canadians, almost pretty much all Canadians, unless you're taking vitamin D or tanning in the winter, you're going to be deficient, just because there's not enough UV rays where we live. So I was just kind of shocked that that wasn't promoted, right? Um, and then, like, that's just the tip of the iceberg, right? Because there's also treatments, and other things that, and other
Yeah, for,
public health measures, right, and general health measures that can help people to survive COVID, were not even mentioned, right?
yeah, and coming back, to the vitamin D. I mean, like you said, people should be taking this anyway. Like, and I'm sure you see this, in your practice or in the emerge. Whenever I order vitamin D levels on people, they're almost always deficient,
Yeah.
almost always deficient. And as we know as well, multiple studies have shown that, like for the standard upper respiratory tract infection, you're less likely to get an infection and to get a severe infection when you have high levels of vitamin D. And on that note too, I always like to mention, some specific numbers regarding vitamin D, because, I believe that the recommendations overall are too low. And, I see people who, they're taking 2,000 IUs a day, and they're coming in and they're testing and they're coming back low, and they're saying, like, what's going on? I'm taking my vitamin D. And, I think that we need to change some of the guidelines, because, whenever I test people, like, they're always low unless they're taking like at least like 5,000 IUs a day. And I know it is, a fat soluble vitamin, so we do have to be careful with it. You can have some toxic effects,
Mhm.
but generally speaking, that's only when you're taking more than like 10,000 IUs a day for years or months,
Yeah.
so there's a vitamin D society, or vitamin D council, that I've been following since about 2014ish, and they've always recommended about 1,000 IUs for every 25 pounds of body weight, which, to some people might be quite a bit. But, like we said, I mean, even if you and I are wrong on vitamin D and COVID, which I really, really don't think we are, because the evidence is overwhelmingly positive,
Mhm.
you should be taking it anyway to, reduce the incidence of the common respiratory tract infection, or the
Yeah.
common cold, and to reduce the incidence of osteoporosis. There's evidence that low vitamin D is associated with low testosterone. There's evidence that low vitamin D is associated with depression. So, I think that, like I said, even if we are wrong, which again, I don't think we are, people should be taken anyway, and especially people in Canada. And I mean, in Northern Ontario, when you are, I mean, you guys probably get, even less, days in the sun than we do here in Southern Ontario. So,
Yeah.
for sure, something that like needs to be addressed. And like you said too, like, I still don't even really think there's been, very much in the public or the media about, about telling people to take vitamin D. Like, can you recall if like Dr. Tam or any of the officials in Ontario at least have mentioned anything about vitamin D?
Nothing.
Yeah, yeah,
Yeah.
it's crazy. So, yeah, I mean, definitely something that a lot of doctors now recommending. And the other thing too is that it's cheap and it's safe. As long as you don't go crazy with it, take the
Mhm.
recommended amount, then you're not going to run into any trouble with it. But I know that there's some other treatments out there, and I retweeted you today on your ivermectin post on Twitter.
Yeah.
So yeah, if you could just maybe chat a little bit about ivermectin, and why I think that should be more widely available and prescribed.
Yeah, so ivermectin is a very widespread, cheap medication. It's actually won a Nobel Prize for the treatment of river blindness, and so it's a medication that's used across the world, primarily in tropical countries for the treatment of parasites. But they've also found that it is highly effective against viruses as well. Um, and so it's effective against COVID, but also like dengue, Zika virus as well. And I think there's a few others that it's shown effectiveness against. But basically, what it does is it blocks the proteins of COVID from entering the cell nucleus, and it also blocks replication of COVID. But what's even more like great about this medication is that it's been around for decades, right? And it's super safe. It's over the counter in most countries around the world, because it's used just to treat parasites, right? Including scabies and things like that across the world. And so most people can get it without even a prescription. But in Canada, you do need a prescription for it. That said, we have medications over the counter that are actually more dangerous than this. So like Advil, causes GI bleeds, causes death, kidney failure. Like Tylenol, if you think of Tylenol, people die every year from Tylenol overdoses, right? And liver damage that can happen from those. Like the side effects uh, of um, ivermectin are much more mild than even those. So in general, most of them are even just associated with its primary treatment. So like, for example, with the river blindness, when you're killing off the parasite, it can often cause a reaction, and most of the side effects are associated with that one treatment. Otherwise, there's very few. So things like dizziness would probably be the most common side effect, but otherwise it's very benign. It's like the toxicity is very rare and takes a huge dose to actually cause toxicity. But anyway, so what's happened with COVID is that this super safe, widely available medication has started to be researched, and the evidence is piling up quickly, especially over the last 4 to 6 months. There have been a huge amount of RCTs, like I think close to 100 RCTs and almost 200 studies in general. 15,000 patients have been studied, and at least 4,000 in good quality RCTs, showing that there's a massive effect for ivermectin. So overall, like in a meta-analysis of the RCTs, there's a greater than 68% reduction in death from ivermectin.
Massive,
So that's,
massive reduction.
yeah, it's massive. Like that's like we give medications that have like tiny mortality benefit, right? You think of statins, um,
Yeah,
and other medications
very
that we
good
give, they have
example.
a tiny effect on your overall mortality. And yet we give them to absolutely everybody, pretty much, right? Like who has
Yeah,
a risk for heart disease. So like this has a huge benefit, and it's being ignored, and which is kind of crazy. Like I understand like it's taught me really a lot about how medications are adopted in the medical world, and sadly, it's not just based on evidence. It's really it's people go off what other people are doing, right? So if you're doing something that nobody else is doing, even if it's based on really good evidence, people think you're dangerous or you're like some sort of a maverick or something, right? Like medicine is a very kind of conservative, conformist kind of culture. So it often takes a lot to stick your neck out there, even if you have massive amounts of evidence behind you. So yeah, like in something like COVID, where the evidence is rapidly developing, but now is becoming increasingly solid. Like something like ivermectin, like really needs to be in like in every doctor's pocket when we're talking about treating COVID. Because right
yeah,
now, like, sorry, just right now, like our standard of care for COVID, when you get a COVID test and you see your doctor, basically what we're supposed to tell you is go home until you can't breathe anymore. Like that's
yeah,
what we tell people. And like when there's evidence-based treatments available, right, that can keep high-risk people out of hospital. And I don't think everybody should be taking ivermectin. Um, I think we know so much about COVID, like, and its risk factors. So like we know like who's actually going to be harmed from COVID. And it's usually people over the age of 50. If you have obesity, if you have hypertension, um, those are kind of the major risk factors, or like darker skin as well, because it leads to lower vitamin D. But
and being
um,
male as well. I think males
yeah,
tend to die more than females,
yeah.
unfortunately for us.
So if you have any of those risk factors, then I think if you're diagnosed with COVID and you have symptoms, right, it's not just a positive PCR test, but you have COVID, then I think we should be treating people with ivermectin and to keep people out of the hospital, right? Then we don't need to lock down if our hospitals aren't overwhelmed. So
Absolutely. Yeah, and I saw, at least I know there's several, but I always really pay attention to things when I see, a dose dependent response.
mhm.
And at least one of the RCTs that you're talking about, and for people who are are listening, RCTs are randomized control trials. So, that would be the highest level of evidence in medicine. So that's basically when you give the medicine to one group and then you don't give the medicine to the other group, and then you see what happens. But in one of the RCTs I was looking at, I can't remember the exact numbers, but the more of the medicine you gave, the lower the mortality and the fewer days they had until they had a negative PCR test. So, it treated the symptoms, and then it also, produced a negative test. And again, that was in a dose dependent manner. So, I think the dosages were something like 4, 6, and 12 milligrams, something like that. But so for every increase, what I'm talking about is in this particular study is that there was a decrease in symptoms, and then also a positive influence on their PCR testing, meaning that it took them fewer days to reach a negative PCR test as opposed to the placebo group. And yeah, the ivermectin thing is a little bit strange too, because I've only used it for licensed scabies, prescribed that for patients in my practice before. And yeah, it is very, very cheap as well, just like what vitamin D is. I'm not sure if you've looked into this. Like I haven't, and I don't mean to put you on the spot, but I'm not. What is exactly I know you mentioned it a little bit. It binds to some of the protein, but people say that it's an anti-parasitic medication, and this is a virus. But the evidence is the evidence, and I can't really explain exactly why it works. And maybe you already have explained. Maybe it is just because it binds to that protein, so it inhibits the entry of the virus into the cell, and inhibits the replication. But is that more or less the overall mechanism of action, or is there anything else that we know about that?
That's all I really know about it. Yeah, there could be more. I'm not really sure. Yeah, like um, I have to admit, like I haven't really looked into that beyond just what I've kind of read about it, that it inhibits uh, virus replication and
Yeah.
kind of binds to some of the proteins that are needed for replication. Um, but it's not entirely surprising because we have like so many drugs. Uh, in medicine that we find out have tons of different functions, right? That are
Yeah,
they're often unrelated, right?
yeah, exactly. Well, the biggest example of that I can think of is Viagra, just because that was originally, and it still is used for pulmonary hypertension. I'm not a hospitalist, so I've never used it for that matter. But that was given to patients in hospital, and they kind of mentioned to the doctor that they had a positive side effect from it.
Yeah,
So sometimes that does happen in medicine.
yeah.
But getting back to some other things and advice that we can share with people is, I've discussed how our immune system is important before, and obviously vitamin D is part of that. But also too, just as you mentioned as well earlier, like obesity is also a risk
Mhm.
factor. So you definitely want to keep your weight low. We also know that having high blood sugar, is not good for your immune system. And just take a look at any diabetic, especially diabetic who doesn't take care of themselves. They're
Yeah.
much more prone to infection. Um, Same thing with eating like ultra processed foods can harm your immune system as well. So
Yeah.
I don't know how much this is really being discussed and told to the public about how like we should be taking care of our immune system. And again, like everything that I just mentioned, people should be doing anyway. You should try and manage your weight so that you have a good healthy body weight. You should try to avoid eating sugar anyway. You should try to avoid eating ultra processed foods anyway. You should be sleeping 7 to 8 hours a night if you can, just because that's going to be beneficial for your immune system, for your mental health, for your hormones, for everything. So have you heard much about some other doctors or any health officials like discussing anything with regards to our immune system and how we can enhance that and how that can fight COVID?
Um, Not from any official channels. So yeah, I've definitely talked to a lot of doctors. I've worked with actually a lot of doctors. We put out some videos and things on things that you can do for this. And I think the things that you just mentioned are huge, right? We found out very early in the course of COVID what the risk factors are for severe disease. And and so yeah, so like you said, obesity is definitely one of them. Um, but what I tell my patients, and I think this is very encouraging, is that I don't think it's that obesity puts you at higher risk from COVID. I think that there's a common cause that impairs your immune system and also causes obesity as well, and that's insulin resistance, right? So high insulin levels, and that's something that's fixable quick. So you don't need to lose like 20% of your body weight, right, to be able to restore that immune response. You can actually restore your insulin sensitivity within weeks, right? Even if you're very obese and you don't have to lose all your weight first. So things like intermittent fasting, um, ketogenic diet, exercise, things like that can actually restore your insulin sensitivity, which restores the immune response before you actually lose the weight. So a lot of times people hear like, oh, if you just lose the weight, if you're not obese, you'll be safer from COVID. But I don't, I'm not convinced that's necessarily true. I think you can reverse the insulin resistance, and people can become healthier quicker, even while they still have a lot of extra weight on them. But they'll be heading obviously in that direction of losing that weight. So I try to tell patients that, like, look, just losing the first 5% of your body weight, right? Um, that's often all that you need to kind of restore that immune response. Because it's the insulin, like it's the insulin receptors, I believe, on the immune cells that um, affect their kind of performance. Yeah, that's one of the things. Um, Other than that, yeah, like also stress and human connection. There's a lot of research on social isolation impairing your immune system. We know that stress and isolation, people who are in solitary isolation in prisons, or people in general who just don't have good social connections, who don't have family, they don't get hugs, they don't have those connections. Those people do worse, and they're actually more susceptible to infectious disease. And that's been well established over decades, right? So this whole idea of being more protected from disease, at least the more severe consequences of the disease, not necessarily catching the disease, right? So, like, yeah, obviously, if you have more contact with people, there's more likelihood that you're going to come in contact with diseases. But as far as actually becoming sick with them, there's not a like actually people who have higher social connections um, tend to have better immune systems and they don't become sick with these diseases. So it's interesting, like the whole philosophy of the medical community um, with regard to qualifying what a case has really changed. So a case now is a positive test, right? Whereas in medicine, a case used to be somebody who was sick with a disease. And if you found somebody who was not symptomatic with the disease but had a positive test, you used to say that they were immune, right?
Yeah.
Because immune people, even say if you had a vaccine or if you have a very strong immune system, you can come in contact with the flu. And if you did a swab of your nose, you could still have the flu in you, but your immune system is fighting it off to the point that you don't even feel it anymore, and likely are not really capable of spreading it to other people. But that's completely changed in the last year in the way that we've approached COVID, because we now call people sick who have a positive test and absolutely no symptoms, right? So it's like, so yeah, I think the fact is that social connection protects you from sickness, right?
That's
Because
insane. I actually,
yeah,
I'm kind of embarrassed to say that I actually wasn't aware of that. Like, I'm very aware of how, social connection and human connection is vital to, our overall mental health and well-being. And, there was a very famous Harvard study that was done fairly recent where they followed people for like 7 years, and by far the number one predictor of mortality was social connection, like even more than than exercise and diet and everything. And I've heard some researchers say that being lonely is just has just as bad of an effect on your health as like smoking like half a pack of cigarettes a day or something like that. So
Yeah.
I guess it shouldn't have surprised me that much. And then also too, the people who seem to have gotten sick from COVID, who are generally sort of like young, or who are young, they seem to have had like they were kind of going through a period where they were a little bit like run down, so to speak.
Mhm.
Like there was one guy, I think his name is Michael Yo. He was on Joe Rogan, and he did get sick with it, where he had to be hospitalized, and he's a fairly young guy, like I think he's in his 30s, maybe he's in his 40s, something like that. But he when he got sick, he had just like done like 2 or 3 comedy shows, and he went from doing that to like taking his kids on vacation, like driving, which is probably super stressful. So I think that the people who tend to get sick, oftentimes it's because they were run down in the first place, which just goes to show that like your immune system is very, very important. And I like what you had to say just about the lockdowns, because I want to chat about the harms of lockdowns today. But I actually didn't realize, like I said, that one of the things that it's doing is actually damaging your immune system. So and you said like there's studies on prisoners and stuff like that. So that's crazy. So thanks for sharing that with us.
Yeah, for
Um,
sure.
but yeah, so like in terms of the lockdowns, like what do you think is probably the worst harm that's going on right now because of the lockdowns? Like, do you feel that it's just like poor deteriorating like mental health overall, or like missed maybe appointments or something like that, or missed because sometimes we do pick up cancer like randomly when someone comes in for something completely different. So like what do you think is sort of like the worst or harm overall of the lockdowns?
Yeah. So I'd say mental health definitely is number one. There's definitely like huge physical health things as well, but mental health for people in general, but I've noticed it especially for children. So children, it's pretty rare to be honest for a child to be suicidal, and one thing that I noticed through the winter, like our lockdown up north was not nearly as bad as it has been in the rest of the province. But when the schools closed up north, and people were locked up in their homes, I had never seen so many suicidal children coming into the hospital. Um, like it was several a week, and I only see about 15 patients a day, right, in the emerge. And like to see all these kids like from the age of like 8 to 17, I noticed their mental health was awful. And these are people that kids are actually they are very resilient, right? Kids when they have what they need to be healthy, they're very resilient and resourceful at meeting their own needs, like through play, through friends. If they're not meeting their needs with somebody like their parents, they can often find other ways of doing that. So it's very rare for those kids to ever have to come into the emergency department because they're suicidal. So I knew there was a major crisis going on when I started to see that. And and that was basically because of those same things that these kids, and I noticed that it was often kids who didn't get along well with their parents, which sometimes is part of abuse, and other times it's just part of being a normal teenager. But then having absolutely no other options. They've lost their friends, right? They lost school, they lost hope for the future, they lost play, um, and these are children, right? Giving up on life, right? And it's not that super rare in the general population, but to see that in children, there's just something horribly wrong.
Yeah, I
Um,
think I saw a stat that said that the increase in kids calling the kids help phone or suicide hotline like went up by like 2 or 3 times. Is that?
Yeah, I think in 2019 it was 1.8 million, and I think it was something like 4.2 million calls to the Kids Help Phone in 2020.
Yeah,
Which,
okay, that was what that's exactly what I was referring to.
yeah,
I saw
yeah,
that somewhere. And yeah, I mean, that's, it shouldn't be shocking for people, but it definitely probably is for a lot of people to hear that. But there's a lot of people, like you said, where like they don't have a good home life. So going outside of their home, meeting their friends, and also meeting their teachers in schools. Like I know teachers who tell me that, like, you know on a Friday afternoon, their kids give their hug, or sorry, give their teacher a hug, because they know that they have to go back home now to their parents, and they're kind of scared of that type of thing,
yeah.
which is very, very sad to say. But I think there's probably a ton of increase in child abuse, and unfortunately domestic abuse because of this.
Hmm.
So I feel, I agree with you. I think that, probably we'll find out later on, but I do feel that the worst harm that we've done with the lockdowns is in mental health overall.
Yeah.
And it is probably harsher on children than on adults. But, that being said, I mean, I know it's been very difficult on adults too. Like, I've seen people say that divorce rates are going up, and I know of at least two couples personally that have like broken up because of COVID and the restrictions and that type of thing. And like these things aren't really talked about in the media, but obviously that's having a severe effect on people's quality of life if you're losing your partner, your spouse, your significant other, right? So something that a lot of people aren't talking about these days, that we need to talk about more about. And also too, for coming back to the kids, like especially kids who are between the ages of like 2 to 5 years old, or 2 to 6 years old, when they're like just developing, and like you're supposed to be able to recognize like a safe person from a dangerous person. You're supposed to know like who a stranger is, who your mom is, who your doctor is. You're supposed to know these things, and you know them because at that age you recognize people's faces. And having a mask on over someone's face is obviously going to have an effect on that. So I really, really feel for parents right now who have
Hmm.
younger children, because I do worry that it may have long term consequences overall. Like, we don't know what the harms are of children wearing masks and having to identify people wearing masks in the long term. Like, we just don't know the harms of that. So I think that we definitely need to pay more attention to mental health, and weigh the risks and the benefits. And like I had mentioned yesterday, I think one of my tweets got a little bit thrown out of context. Is that, like, I'm not saying that like there's zero benefit to like the lockdowns, and like like Patrick and I both said, like, in for a certain disease, that, but it's not COVID, but for a certain virus, it may in fact be necessary at some points to do a lockdown, like possibly. But for COVID, we don't need to do that. And I feel overall that the harms of a lockdowns are certainly outweighing the risks of it. And going back to some other things outside of mental health, like there's definitely people who are supposed to go see their family doctor, and again would have identified either a cancer, or maybe early stage diabetes, something like that, and they're not going to their doctor now because of that. And you feel that like that's also going to have a massive impact um, down the line.
Yeah, definitely. And I think like one thing, because I put a lot of thought around this, because obviously everything's kind of changed in the world, and everything really has changed in medicine, the way that we approach it over the last year. But what, like, when I look, you look at the depth of it, like you look, like what's at the bottom of all of this, right? And I think the philosophy of lockdown is that somebody up in an office somewhere in Toronto or wherever the capital of your city is, like, or of your province, it is saying that they know better than people what's good for their own health. And I think that's the dangerous idea that's caused a lot of harm. And I'm not against lockdowns in the sense that like I think public health, like we should encourage people to do things, right? To educate them on the risks of diseases and of different activities. But I think ultimately people are the best judge of what's most important for their own health. And that's the way that I've always practiced medicine. I think that's the way that most doctors practice medicine. We don't force people into doing things because we know what's better for them than they do. We offer people options and we educate them and we encourage them to do things that we think are beneficial for their health. But ultimately, it should land with them. And what I'm seeing is the people most damaged by lockdowns are the ones where it's blatantly clear, right, to them, or if it's a child to their parent, right, that this is causing massive harm to their health, like those suicidal children that come in, like who aren't allowed to see any friends or anything, right? Like I think the fact is, at some point, for a lot of people, like people with cancer or people with depression, right, that these it becomes painfully obvious at some point that this is not good for their own health, and so those people should be able to change course, right, and those people can go visit somebody because clearly something's going to be a bigger threat to their health than COVID at some point. If you're depressed and suicidal, you sometimes need to talk to somebody. You sometimes need to visit a friend, right? And I
Mm-hmm.
think it's something that just used to be obvious to so many people before this year. And I'm not against people staying home if they like if the risk of COVID is higher than the risks of their other diseases, but we don't know what's going on in millions of people's lives. Those people do, right? And so um, I think lockdowns or encouraging people to stay home or restrictions on activities should all be voluntary, because I think it's dangerous to tell people without even any kind of recourse, right? Because these public health officers don't even ask people what's going on in your life. Is this lockdown in your interest or not? And so a lot of people just ended up getting thrown under the bus. A lot of cancer went untreated. A lot of heart attacks went untreated, right, because of the fear put into people, and a ton of mental health has
And
been
substance
untreated.
abuse, I think, as well. Sorry, I didn't mean to cut
Yeah,
you off there, Patrick,
yeah.
but some substance abuse issues as well. Like I think alcohol, more people are abusing alcohol now. And then also too, I saw at least one stat a while ago that said that, people have put on a lot of weight during the lockdown. And, we all obviously we know that, obesity contributes to is a risk factor for COVID, like we talked about, but it's also obviously a major risk factor for heart disease, which is the number one, killer in North America. It's a risk factor for cancer and other diseases as well. So, we really need to make sure that, we're discussing these things openly, instead of just telling people, like, as you said, just to stay home, like, and I don't have, any, problems with people doing that, but,
Mhm.
like yourself, I think that people should be more independent. They should have freedom. They should be, thinking freely. They shouldn't, just do exactly what their government says, because, that's not how you get the best results. You get the best results by, allowing everyone to speak their opinion, and then you kind of see what wins.
Mhm.
And right now we're not seeing that. We're just kind of seeing one opinion from, either one guy and Doug Ford, or one lady and Dr. Tam, and that's kind of it.
Yeah.
But people need to start thinking for themselves. And I feel too that, people who are speaking out against COVID, for the most part, they're people who have spoken out against something before,
Mhm.
and for myself, I was, kind of ostracized a little bit when I started prescribing, cannabis. And, I'm a big believer in CBD oil. I do think that's effective. And I
Mhm.
talk about the harms of cannabis all the time,
Yeah.
and I don't think that people should be smoking it at all. So, I think that there's a lot of people in this world, you know, who are against lockdowns, who also, you know, have are independent thinkers and think, you know, about other subjects and think independently, you know, about other subjects as well. And I know we only have about, you know, 5 or 10 minutes left, and then there's a couple other things that I wanted to quickly discuss with you. But you know, at first I was, you know, really into people wearing, you know, masks, and you know, I still wear masks, and I still feel that, you know, they definitely have some effectiveness overall. But you know, it's a lot different, as you know, as someone who went through med school and still, you know, working in the hospital, that like, you know, when we were going into surgery, like you're washing your hands, and then you're putting on a clean gown, you're putting on a clean mask and clean gloves, and then you're not allowed to touch yourself, right? So like, of course that's going to be effective for reducing infection. But I mean, you know, you can go into an establishment anywhere as long as you have a mask on, and that mask could be, you know, grabbed from your back pocket. You know, you might have had it in your car for like 6 months, you know, and then you just kind of grabbed it. So like, you know, you got your hands on your cell phone, on your keys, on all these other, you know, dirty kind of objects. So like, can you just kind of, you know, speak to a little bit about, you know, the effectiveness of masks, and if they are necessary, and that type of thing?
Yeah, so it's funny, like masks. There's actually so little evidence behind them. They're mostly based on just kind of expert opinion, but actually, I've looked into it, and actually a lot of doctors have, and researchers, right, into the effectiveness of masks in preventing viral transmission. So the big premise, right, is behind these masks is that viruses are primarily transmitted through big respiratory droplets, ones that drop within 6 feet. That was what we base this on. And actually, a lot of this was not disease or patient-oriented outcome research. It was research on like mannequins, right? Like there were just mannequins where they got them to spray like liquid out of their mouths and see where it landed, and see whether the mask stopped that spray, like from, for example, a sneeze or a cough. Um, but there have actually been like real world research, like randomized control trials for influenza, like healthcare workers working on the floor, where they randomize different floors to mass cloths versus like surgical masks, and just looking at masks in general. And the evidence is really poor. There's no real evidence that masks prevent the spread of viral infections. And also there is actually is evidence that the use of cloth masks increases the risk of viral transmission of influenza. And likely the reason for that is that when your cloth mask gets saturated with your breath, because we're breathing out water vapor all the time. Once it's saturated, you're actually nebulizing whatever gets onto your mask. So if you had a large droplet that got onto your mask, but then you're breathing through that mesh, you will actually nebulize a droplet that would normally fall to the ground, then becomes a cloud of air. And I think what we've really learned from this, including studies of counties, for example, in the United States, where there were mask mandates versus where there weren't, there was no significant difference. And if anything, there was a trend towards lower rates of transmission in counties with with no mask mandate.
I wanted to ask you about that because I
Yeah,
saw Justin Hart is a guy I follow on Twitter. No relation to me, but yeah, he that was the study that I saw that compared states with mass to no mass. And yeah, I didn't mean to interrupt you there, Patrick, but yeah, if you could just chat just a little bit about that study, because from what I understood, it appeared that the states that didn't have masks actually had lower rates of infection and lower cases. Is that accurate?
yeah, that is accurate. If you look at New Jersey, they had the longest and strongest mask mandate of them all, but the highest case count. But even more compelling actually is a study of counties within, I believe it was within Florida, because Florida doesn't have a statewide mask mandate, but it does different counties actually do. So
Okay.
when you compare counties in the same area, um, they actually found that they followed the same curve, but the curve in the air in the counties without the mask mandate was actually lower. So I follow I think Robin Minotti and Dr. Urso, I think, as well on Twitter, and it's put out some really good research and some of like the basic science behind it. But wearing a mask does two things. So one, especially a cloth mask, it will nebulize what you're actually spraying out. And the other is that it blocks droplet transmission. So it does block droplet transmission, we know that, but it doesn't block aerosolized transmission. And so likely what they're doing is preventing you from getting droplets, droplets that would actually hit your mucosa and start your mucosal immunity. And instead, what it's doing is blocking those. And so preferentially, people are getting aerosolized transmission, which would bypass your mucosa and go right into the lung. So there is a trend in areas where there's high mask um, compliance with a higher severity of disease. Because the way that our mouth and nose is designed is that when we come in contact with things, we have tonsils, we have like a whole system of catching things before they get down to the lungs. So like our mouth and nose are meant to do that. And so the idea is if you get hit with a droplet rather than an aerosolized virus particle, our body is designed to start the immune process right away. And so you can become immune to a disease without it getting all the way down to the lungs. So that's kind of the theory behind it, but there is compelling uh, RCTs and just the population-based observational data that shows that masks are not effective. I think if we're going to believe that they're effective, they should be filtering what we're the air that we're breathing. So I think if anything, it should be an N95 or higher, right? A PAPR or something like that. Those do have evidence for preventing the spread of viral illnesses. But these masks that with the holes in the sides, you're just breathing through them. So even double masking makes no sense because there's big holes on either side. You're not really filtering the air.
Yeah, and like you said, I think there's quite a bit of evidence for that right now, and
Mhm.
with Florida and Connecticut, which is super surprising, opening
Mm.
up,
Yeah.
and I think there's a couple more states I'm missing there, but and Texas, opened up just recently. Like we're gonna have some data come out, really really soon, I think.
Mhm.
And Patrick, man, I'd love to chat with you some more, and I'm sure we'll have you back on,
Yeah,
sooner
definitely.
than later. But unfortunately, our hour is basically up here. So you shared a ton of knowledge with us today. I'm sure a lot of the listeners are going to want to, follow you. So if you can let people know, how they can reach you, how they can follow you on the internet, that'd be perfect.
Yeah, so probably the best way to follow me would be on Twitter. That's where I'm most active. And my Twitter handle is Dr. P underscore MD. So DRP underscore MD.
All
Thanks
right.
a
Well,
lot for
thank you.
having me.
Yeah, thanks so much for coming on the show, brother. Really do appreciate your wealth of knowledge on COVID, and I think this information needs to be out there. So I'm happy that we did this today, and I'll let you know when we start sharing it with everyone.
Yeah, thanks so much for having me.
Okay, thanks,
Have a good
brother.
one.